Okay, great. We've just hit the 2 o'clock hour, so we're going to go ahead and get started. On behalf of the Admiral at the Lake, welcome to our webinar, Discover the Benefits of Assisted Living, a virtual presentation. Thank you to our panelists who joined us today. We have Dr. Eric Mizuno, our medical director, Mark Dubovich, our health services administrator, Angela Jalla, our director of nursing, and Michelle Roth, our wellness coordinator. My name is Katie O'Brien. I'm the director of sales and marketing here at the Admiral at the Lake. The outline for our time today is we're going to spend the top half of the presentation with comments by our panelists, around 5 minutes or so. So we'll spend about 25 minutes with comments and some specific questions that we've been asked. And then we'll have opportunity for some Q&A. And whenever the Q&A wraps up, we'll be finished, but we promise to be done within the hour. So that's a little bit of our time today. So let's get started. We're going to start with Dr. Mizuno. And if you wouldn't mind introducing yourself and telling us a little bit about your background, Dr. Mizuno.
Hi, everyone. Thank you for spending time with us today. My name is, as you said, Eric Mizuno. I'm 5'5". I'm 150 pounds in a good day. And I was born and raised in Chicago. I'm a very proud Chicagoan and an unlikely product of the Chicago public school systems. I came back for medical training here in Chicago and did my residency training at Northwestern, where I stayed there for actually almost exactly 30 years. I was asked to be on clinical faculty there. I helped develop a very large practice of 300,000 patients. And I felt like for me, God, but things in my urging was moving me in a different direction. And long story short, it ended up me at the Admiral at the Lake. And I'm very proud and privileged to have been the medical director here for the past 5 years. But things didn't really start taking off until the nuts and bolts and the things, no matter where you guys end up, they say the right thing to do is asking the right questions. And this is an amazing place. I think two things. It's the staff and the residents. And one anecdote that I've told before was just when you stress test the system, to me, you find out where the weak parts are. And so for all of us in different ways, it was, of course, the pandemic. And I was astonished when I was looking over numbers a while ago to see that we were really literally running about 10% of the prevalence figure that all other buildings were running throughout the city. So, I mean, it's always a little bit of apples and oranges, but we were running about, 10, it was a number I couldn't believe. And then I realized that the only way this could possibly happen was because because you can't mandate certain things, you can request. And everyone was kind of minding their P's and Q's. They understood that the science of it, they were willing to give up personal freedoms for the greater good of the community. And just extremely proud to say that this, to me, it meant like every resident, every staff member, they heard what we're basically just asking people to do, but they understood that community comes first. And these ended up in these astonishing numbers that continue to this day. But one thing I'll tell you for sure, that when you talk about a nursing facility, either skilled nursing or assisted living, and these are maybe parts of your vocabulary that you're just learning, we're happy to kind of help you through what the differences in these levels of care are, but they don't happen without a day-to-day person. And I kind of give my advice, and I'm always happy to talk and share my opinions freely. But the people that are there every day, and the people that head up are the healthcare services administrator, Mark Dubovich, and our director of nursing, Angela, that they'll share some of their words with you. But I think their problem is they'll likely be modest they'll just describe what they do. And if they're there each and every day, and I've seen both of them, they'll literally just pick up boxes. There's nothing beneath them. And I think in doing so, you show leadership by example. And this is what they do each and every day. And to me, it ultimately gets down to the nurse and the caregiver. It's often the person who is paid the least that is the most important person. And at the hospitals that I'm at, I know the janitors, I know the people that answer the phones, and I always tell them and the workers that, if I ask them what they do for a living, they'll say, well, I mean, I do this or that. They're very specific about their job duties, but I make sure they understand that, no, I mean, you save lives. And if everyone doesn't do their job, and maybe I could do some environmental services, it wouldn't be maybe the greatest job, it wouldn't be that clean. You should see, my car maybe, but somebody has to be the expert at doing this. And it's each of us are not doing that thing, then the whole thing sort of falls apart. And I think that's the spirit of so many workers at the Admiral. And everyone knows how COVID changed the way people were paid, that we were paid to stay home. It wasn't meant to be that way, but it sort of ended up that way. Our vacancy rate of staff, I mean, we've held strong through this very difficult time of staffing, and I've been at other facilities where, I mean, they were clearly there just because it was a living. I think for a lot of people that work at the Admiral, it's not just a living, and that it's a minimum. I mean, it's a calling, and they feel they feel compelled to the relationships that they develop with the residents here, that they sort of become an uncle or an aunt, and they feel like beyond just having to make money to pay the rent, it's more than that. And they feel like everyone needs a purpose in life, And I think this provides a sense of purpose for them. And we just have the right people. I mean, it's about people. The process, thanks to, once again, Mark and Angela, has been perfected. And then they say the product, and I guess that's what we're talking about here today. But without the right people, it doesn't matter how good the product is, and the processes are well thought out. Somebody's got to put that where the rubber hits the road at the resident care interface. And to me, those are the real heroes, the ones that just really deep kindness, and the stuff that puts a lump in my throat when I see what they're doing, and it's all done in this unheralded way, and they do it each and every day, and I know that because of what the residents say. And we, like many places, there are some that they're just easygoing, that they're happy with any care they get, and in every population, there are residents, they're very discerning, and that's what they deserve. And they're hypercritical. And when they tell me that, they're so happy to be at the Admiral because of, and they mention names, I'm like, you're absolutely right. We find those people out and we let them know. I mean, thank you so much for doing what you do. So
that's beautiful.
That's me, the Admiral in a nutshell.
Yeah, thank you so much. That's beautiful. And I totally agree. It's all about the people and the care. So one of the questions that we have is, that was submitted, is how do I know if assisted living is right for my family member or for myself? Like, how do you talk to people about assisted living as the appropriate level of care and taking the steps to make sure that they're in the right community?
So I think, and this is where, so definitionally, you're either living independently, don't need any help. And then there's two silos, you're independent or you're dependent. Then the question becomes, well, how dependent are you? And specifically, what are your dependency needs? If they're medical, well, that's sort of slightly complicated, and that ends you in what euphemistically is a nursing home, we call skilled nursing. And that's where you need a nurse to do this for you. There's complexities and training involved. If it's non-medical services, but you definitely need some help, and you don't want to end up in a nursing home situation, well, then you should continue to live sort of quasi-independently. You just need a little bit of assistance, but it might be something like, I need a little bit of help with my food. It could be eating, it could be just with bathing. These are not, they don't require any special training, but what we call the activities of daily living are not quite where you or your family may prefer you to be. And, you should have dignity in life. And we're pleased because we actually get to feel useful. If you let us do this, we have a purpose to life, and we're more than pleased to provide that. So that could be bathing, eating, what we call the activities of daily living. But if you reach this line where you're on this side of the line where, no, this is medical, this is, IV antibiotics or something that's clearly medical, that we don't provide on assisted living, but we have a continuum where you're part of the family now and you can come down to the floor. where we do provide those services and you haven't left the building or the familiar faces that you see. Because I think it's more than just like at assisted living. Does the facilities you're looking at, is there a continuum of care? Because as you go from here to here to here, can you stay in the community where you've already gained some sense of familiarity with the staff, you feel comfortable there, and then you're leaving to another place where you kind of have to do the whole research process again. And the people that know you, the faces have changed, so.
No, thank you. I think that's good insights into how to know what's next. So next we're going to go to Angela Jalla on our panel, our Director of Nursing. So during this panel, you're going to get to meet our team here, and Angela's next. Angela, could you please introduce yourself and give us a little bit of your background?
My name is Angela Jalla. I am the Director of Nursing for our assisted living, memory support, and skilled care. I do pride in working in long-term care. It's a call, like just what Dr. Mizuno said. Every resident is really important to me and a priority. And one of my take is I don't treat just the resident, I treat in an holistic way, meaning the family is just as important to me as our resident. So the family is included. It doesn't matter who that family member is. If that is important to the resident, it's important to us at the Admiral at the Lake. I have been doing this for the last 16 years. I started off my career with CJE, and I was taught by the best in the field at that time. And I was raised by my grandmother, so caring for the elderly is like caring not just for like my for an elderly person, it's like for my mom as well as my grandma. So it's very personal to me. When we think about assisted living, I love the idea of the CCRC because assisted living is like living independently, but with a lot of care around you. So that really helps you to maintain your independence, but having someone when you need something different than what it will look like just living alone at home. We do, in our assisted living, we do have full-time nurses, whether it's RN, registered nurses, or licensed practical nurses. And we don't use agency, which is rare to find these days. All our staff are fully licensed and full-time with us, and they are here 5 days a week. So one of the things that we do best is our consistent staffing, meaning the assisted living nurse will be here 5 days a week. In the morning, there's someone, in the afternoon, and at night, it's 24 hours. So whether we're talking about our assisted or assisted memory, we do have nurses around the clock. We do a lot of services that a lot of other places don't do, meaning if you have something that you're hurting or have a fall, we can do an X-ray in-house. Our physician, we'll talk more about that. Physician come in and see you in-house. We have a pharmacy system set up. We'll do all the medication if you want us to. If you don't want us to, that is still fine. Our philosophy is our residents tell us how they want to live, and we can help them live to that best life with us just hand-holding, and we work together. We have different variety. We can do supervision for medication. You can do your own medication. Same with shower, same with laundry, whatever is needed. We have all of those, like Dr. Mizuno was saying, activities of daily living. You will tell us the help you need and we will work towards it. I also do teach at our local community college at Oakton. I do teach CNAs. So you can imagine how much training our staff gets here, because every new thing that comes up, we are like leaders in our field. So I also do work with incredible people. Dr. Mizuno is like one of the best doctors I've ever worked with, not to say Mac. So he is so caring, and everybody here is so caring because we want to make sure this is home and we want to make sure caring for you, it's like caring for your whole family, and we become part of that family with you.
Great, thank you so much, Angela. Can you talk about when somebody comes into assisted living and they're new, and will you talk about working one-on-one with the individual and the family? Can you just talk shortly about that?
Yeah, so if you're interested in our assisted living, we have an assessment that we do. It's not a pass or fail. I always tell residents and family members that. So I am intimidated by exams, so I try to make it a lot of fun. We meet, we talk about what you need. Our goal is, it's not about points, it's about what would you like us to do? What part would you like us to play in your life? Would you need help with medication setup? Would you need help just a standby for shower, activities of daily living, laundry, and all the other things that we do here? So once we've done that, I will let you know the areas and we go over it. It's very individualized. It's not like one fits all. And then you will see how you fit in exactly how you want your life to look like and what is the safest way clinically for you. And after that, we'll ask questions about, some people have outside physician. I will ask them that if they stay in Abbas, Dr. Mizuno will see them and they can become his, they can become his patient immediately. And a lot of people opt for that while still holding on to their doctors that they've had. We have a way that we set it up. Dr. Mizuno is kind enough to connect with those physicians and work with them, and we make it work. So the process is very short. The interview usually lasts an hour, and the rest of it is usually just talking about what you used to do. And now we can still let you share some of those things that you still enjoy doing that we also do here at the Admiral.
Beautiful. Thank you so much, Angela. I think that helps us kind of put ourselves in as, you know, as we look at what would a next step be. So we've heard from Dr. Mizuno, our medical director, from Angela, our director of nursing. Next up is Mark, our health administrator. Mark, could you please introduce yourself? And
hi, everyone. My name is Mark Dubovic. I'm the health services administrator. I've been here at the Admiral for a little over 4 years now. I've been in the field of senior of aging services for almost about 20 years now. So I've worked in a variety of different settings, but the Admiral is a very special place, as everybody's mentioned. It's a place where we just have a huge extended family. You know, we come to work every day and know that I've got these wonderful people living here, these wonderful people I'm working with, and we're just one big extension of each other. And it's really great to celebrate the successes. And even when things get a little tough, you know, your family members, even though maybe your, you know, biological family members not right there necessarily, but you know that we're here and we're concerned about your well-being. So it's just a great place. It's you know, we're always trying to do new things here at the Admiral. So that's it's a very enjoyable place to come.
thank you, Mark. We oftentimes give Mark and Angela a hard time because they'll finish each other's sentences and they work so closely together. So Mark, can you tell us what's included in assisted living at the Admiral? What are the amenities and other aspects of what's all included in assisted living here?
Sure. So, you know, assisted living, I'm going to borrow a phrase from Angela. I think she said this before. It is what you make it. It is what you know, what you need it to be. Assisted living, we can help with lots of different services. You know, not necessarily medical, but we can help with the medication. We can help with activities of daily living. But it's not just that. It's a community. It's where we have, you know, daily activities, daily things that go on that you can join in. Whether it's movies, whether it's games, whether it's a sing-along, whatever it may be, there's something to do. We have a fantastic fitness center and pool that the residents in our assisted living can use. One real special thing about our community is, although there are different levels of care, when you look at someone, that's not what, you know, differentiates them necessarily. Yeah, that may be where they, you know, where they sleep, but it's, you know, the amenities, all the amenities at the Admiral Lake are open to everybody. We have a library, we've got our fitness center, we've got, you know, all these different things. We have a salon, we have in-house physical and occupational therapy. We just started a new program with aquatic therapy. So you could do therapy in our pool, which is really cool. So it's really, really a super inclusive place. We work with the residents in independent living, and there's lots of other programming that you can attend, from lectures to concerts. I think we have 4 baby grand pianos here. So we have internal concerts. Some of our staff are fantastic musicians, and then we bring in musicians from the outside. So there's a lot of different things, but pretty much, meals are, of course, are included. We have a separate dining room for assisted living, but the assisted living residents can go to our other dining rooms as well. So we have, lots of different amenities. I think that you may not see necessarily in an assisted living community where we are able to, because it's part of the broader community.
And you're in one of our resident apartments, and we have
Yes.
a couple of different floor plans. But can you talk a little bit about the cost and what's included and what's maybe not included that would be a
Sure.
separate?
Sure. So there are different levels, as mentioned, there's different levels of care here at the Admiral. Specifically assisted living. The cost is roughly about $9,000 a month, which covers meals, housekeeping, any nursing care that you need, any personal care that you need, pretty much everything that goes on a daily basis. What it doesn't include is anything from, medications, which are not provided by us directly, but by our pharmacy, x-rays, any co-pays or things like that for any medical fees, that would not be covered by the monthly fee. Other than that, maybe if you had a family member come and visit and they'd eat a meal here, that would be maybe separate, but pretty much, I would say pretty all-inclusive. It covers the trips, it covers a lot of the scheduled transportation and things like that. So any outings or any runs to the doctor's office and things like that, it would be covered. We also have memory support, which is approximately, it's around $10,000 a month, and that's for a resident who does have memory issues, who does have a dementia diagnosis, whatever that diagnosis exactly may be, but that they need that memory care. And so that is more, I would say, hands-on care and the day-to-day care. And then, of course, there's skilled nursing. And as Angela mentioned, one of the best benefits of the assisted living here is that we have right below it a skilled nursing unit. So someone does go to the hospital for whatever reason, and they may need a lot of extra help, and they may need that round-the-clock nursing that's really in touch with them. Then they can go into our skilled nursing, and they know it's the same faces. Angela and I are both in skilled nursing. Dr. Mizuno is in skilled nursing. Everybody, you're going to see all the same faces and all the same people. You may have different people who take care of you from a day-to-day basis because they work on a different floor, but you've seen them around, you know them, you have that familiarity, which is really super important.
Thank you. Did you also want to touch base about short-term rehab too? You
Sure.
mentioned going to the hospital and skilled, but we might.
Yes. Right. So what our skilled consists of is we have short-term rehab. So if someone does have a need, let's say someone has a hip surgery, a knee surgery, hopefully elective or and not in on an emergencies basis, but even then, if someone does have some type of need like that, then they can go to our skilled nursing. They can go to a hospital and then come back to our skilled nursing. You don't have to go somewhere and all of a sudden encounter all these new people and a new system and a new everything. Here you're coming back to something where you're in the same system. You're just literally in maybe a floor or two below where you're normally living.
Thank you, Mark.
If I could add to that, also, if you're in assisted living and let me say Dr. Mizuno is doing rounds, and let me say you are dehydrated and you need a bag of IV or two or some little more treatment and continuous care, we can move you down to our skilled, which is just like they said, 2 or 3 floors below, and you can get that service in-house without going to the emergency room or to the hospital. Our staff down there are capable of giving you and providing that care that is needed, that will be in acute setting. We are more than capable of doing that for you.
And then that you're mentioning, and then they would return to their assisted living resident apartment once whatever issue is ailing them is taken care of. Yeah.
Exactly.
Yes, and the point is that you're not, I'm sorry to overlap with the conversation, but so skilled nursing facility has certain skill sets that are actually licensed by the state. And if you're not licensed to do so, you can't do that. So really, I'd say if you have any place you're looking at an assisted living only, they cannot do that. You just can't do that. They can do lab draws out of there, but you can't act upon it. You're going to have to leave that place, go to the hospital. And it's not unusual, like Mark says, if you have, whether it's elective or, as he said, unfortunately, if you have like a fracture and you need surgery and you can't live on your own for a while, you need a nurse taking care of you, then you have to go to a different facility for that skilled nursing care. It could be 2, 4, 6 weeks, and then you'll come back to assisted living. Like you would never leave the Admiral because, I mean, you're our family. Like we don't want anyone else in those beds except for those, and we reserve beds for that purpose. We could have it 100% capacity, but by design, they're meant for Admiral people or the harbors people so that they're there for you in case you need to come back, but you can't go back to your apartment for maybe 2, 4, 6 weeks of rehab. The other thing that's unique, and there are services, and please ask about these the other places you're looking at. Not unusual to have like a dentist, like an eye doctor coming in to check your eyes out. What else? Like a wound person. As far as I know, this is probably unique through a lot of Mark's work and people that we've contacted is dermatology, which is not a big thing, but it's an annoyance if it's Chicago, it's 20 below out. Like, where do you live in the facility for? And you'll come back with your rash with a cream and you'll have pneumonia. What's incredibly, I believe this is unheard of, maybe even nationwide, is we now have orthopedics coming into the building, and a lot of people have osteoarthritic problems, and we want just someone to come by and take a look at them in their apartment. Even just, can we take a look, maybe give an injection? You don't have to leave the facility. We can do x-rays in the building and just get things done on site. You're not compelled to. There's nothing that's mandated. If you have your favorite orthopedic, then, by all means, see your own person. But a lot of times, just like it's really cold out, I just want to stay here. And that's huge to me. I'm not sure if you guys know of any other facility that has this. I think we're the only place that has developed this sort of service line.
And that's a wonderful segue to our panelist, Michelle Roth, who is going to speak directly to some of the unique services that are offered through our wellness center. So Michelle, welcome. And if you wouldn't mind introducing yourself and talking specific to what's all included with the wellness center.
Sure. Hi, I am Michelle Roth. I am the wellness coordinator for independent living. I have been in this type of setting for almost 10 years now, and with the Admiral at the lake for just over 3 years. And just to echo and emphasize what all the other panelists have already said, this is a very special and unique place, not only because the staff are just fantastic and have so many wonderful attributes, but the residents, you really get to become family with them and know them one-on-one. So it has been great. One of the things that I do is oversee the fitness center and the staff, the programming, and the classes. And a very unique thing I see in this community is that our fitness instructor not only teaches in the independent living, but she also teaches in the higher levels of care. So she's in the assisted living, the memory support, and the skilled nursing levels throughout the week, teaching group exercise classes. In addition to that, we also have personal training that we offer. So more individualized one-on-one sessions with a personal trainer. And in addition to that, residents can use the fitness center, kind of echoing what Mark was saying earlier. Our fitness center is fantastic. We have a lot of different pieces of equipment that residents can use, cardio equipment, such as new steps, ellipticals, treadmills, a variety of strength resistance equipment, and then the swimming pool, which has multiple benefits just being in the water and for joint and different muscle work. Something new that we've added to our healthcare provider list is aquatic therapy. And so that's in addition to our therapy services, such as like physical therapy, occupational, and speech. Now we have aquatic therapy, which is a huge service for those who can't always do all the exercises on land or just need that pain relief in the water and more mobility in the water as well.
That's wonderful. And specific to the Wellness Center, the different types of services that are available?
Yeah, so I'm actually located in our Wellness Center, and behind me there's 3 exam rooms. These exam rooms, we have a variety of healthcare providers, like Dr. Mizuno was saying earlier. We have an audiologist, a dentist, the dermatology and vein clinic. We have laboratory needs such as blood draws, and also diagnostic needs such as x-rays. We have a portable company that comes in to do that. We have nurse practitioners who use these rooms, and physicians, and we have a optometrist. Like Dr. Mizuno said, the orthopedic clinic is starting this month, and we are so thrilled that they're going to be here. The podiatrist uses our wellness center. We have psychiatrists and a neuropsychologist. In addition to all these healthcare providers, we have support groups as well that we offer, such as Facing Change. It's a group that supports changes of any kind, changes in maybe a transition from your home into a community such as ours, or changes within your surrounding loved ones. So maybe someone has died, or someone is going through changes, and that's a great group just for full support of people who are going through similar things such as you. And then we also have a caregivers of loved ones with memory loss. So those taking care of people around you who are going through those cognitive changes. This is a group that can support those needs and be there for each other through those changes. And so in addition to the support groups, the healthcare providers, I did want to touch base on the therapy services that we do offer. And we have a preferred in-house provider who, like I said, does the physical therapy, occupational, speech, and aquatic therapy. And we have a very close relationship with this company, and they are just absolutely wonderful and fantastic.
Beautiful. Thank you so much. I really appreciate it, Michelle. It does make me think that one thing that we could touch base about is just what daily life looks like for someone in assisted living. And I don't know, Angela, would you like to take that question?
Yeah. Mac will back me up as needed.
Yeah.
Yeah. So in assisted living, it's almost the same as when you're living at home. You wake up in the morning, you will tell the staff when you like to wake up in the morning. And when you are up, if you need assistance, somebody will come in, whether you need assistance just to check in and say good morning. Some people like to start with coffee. The staff will bring that in. If you need help in setup, like what things to wear, your closet, whatever you need, they will do it for you. At the same time, if you don't need help, the staff will not bother you about what you are not requesting. It will all be upon your request. We want you to understand that. If you say in the morning, I don't want anybody to wake me up, no one will show up. We know you are safe because you have your pendant that you can use to call for help when you need help. So you can make it home as much as you like. You can set up Alexa to wake you up. You can do things that you want, that you're used to doing at home. We don't want to change your routine. We just want to be part of your routine when you need help. If it's your shower day and you need somebody to come and just do standby, cue you, or participate in it, it will be what you need. After that, it's usually breakfast time. You can go out to the dining area. It's really nice. The servers are there that will assist you with whatever your choice of meal will be for morning. In the morning, there are varieties. And then it's exercise. We have morning exercise that is also optional. If you don't want to do that, you can go down and walk around the garden. We have an open area on the 6th floor where you can walk around, or whatever you want to do around that time. And you can also go to the salon if you want to do some beautification work. It's all up to you how you want to spend your time. Then it's time for lunch again. And just a normal day, we have variety of activities like Mark was saying. You can set your calendar and participate in the things you enjoy doing. You don't have to go to something you don't enjoy. You can pick and choose what you want. You can spend your time in your room. The rooms are self-sufficient where it's like suite. So you can take your shower and everything inside your room. You don't have to leave your apartment to do anything. Or you can call your neighbor and go for a walk. People do body up and like hanging around each other. They play puzzle together. It's all up to you how you want your day to look like. And yeah.
That's a great explanation. I think you really hit on the individual, however people want to live their best life, they can do it here. One question that was asked, and I think I'll direct this to Dr. Mizuno, what's the benefit of being assisted living in a community versus staying at home with care providers? What are the advantages, and why would someone pick coming to the Admiral versus staying at home?
I don't think there's one answer for that. I do think when you're in a home for a long period of time, there's a lot of sentimentality to that. And so I can clearly see for some people, the right answer is stay at home and find the care at home. There could be a challenge with that because I think it's, I guess, to speak to our side of things, but I can clearly understand the person that says, I want to stay at home. I'm like, we're here to honor our family. And these are the older people in our family. And if you're older, I have to respect you because you've seen more of life. And that's just something that's, it's how I was born and raised socially, religiously. And so, but kind of love tells us that, well, you need some help. And then if they can stay at home, if you can swing that, I think it's in some cases for sure, that's preferable. There's no argument. There's not that fight like we're taking out of your home. And that transition is always difficult. It's what I call the adjustment period. It's talked about in psychiatry. And so I would reason out that no matter what kind of change, even if you're going to a bigger home, it's a 6-bedroom home and it's your 3-bedroom home. It's just a house. It doesn't become a home till you're there and you kind of get settled in. So even if you're moving up in life, a change is always upsetting. On a Harvard scale, just getting a promotion, a raise in pay, more responsibility, a bigger home, even though it's going in this direction, it's a 10 in a stressor scale. It's a change, it's a shock to your system. And then when you come down, it's easier to identify that as, oh my God, that's horrible. But it's the same in either direction you go. This is what all the life stressor scales tell us. And so we're prepared for this. It's like Michelle was describing, this transition period, it's something we anticipate. That it's going to be difficult. We assume it is. For some people, it's not that hard, but we kind of think this is not going to be easy for a period of time. And then once you're in that new place, it's like, okay, this is home now, right? We're adaptable. That's what we are as human beings. So the real push I would give is that when you come into the transition place to here, and you have those assisted services that you can say, well, you can do that at home. You're not cost sharing that. That's one thing. To have 24-hour care at home 27, it's about, the last time I checked, is about $350,000. I had to do this for my parents. It's not inexpensive to do that. So to over duplicate services you don't need, you can share services. And there's an ample amount of resources we have here that I don't think you have at home. You don't have like a dentist coming to your house. You don't have an orthopedic, a doc, home visits can be done, but I'd say the quality of that in the community, I would say, frankly, is quite poor. Not that I'm the bee's knees, but I mean, I have a certain amount of training in this area, and all the services that we have here that you can't possibly reproduce all these services in the home setting. So that would be my easiest thing, but I totally understand. You got a loved one who says, I don't want to leave my house. This is my house. But there's a lot of challenge to kind of reproduce the expertise of, having Angela or Mark or Michelle to help you with anything that might just come up on any given day. That's the easiest argument from my standpoint.
Yeah, and thank you I think that's a really good perspective that you bring. I think there's also, I think I would ask the same question of either Angela or Mark, to your point about just the sense of community and what you see with people when they, because oftentimes when people are moving to the Admiral, they have been home with care. And I think that there's a sense of community, and then they're coming into a place where they feel less isolated. So since Angela took one of the questions, Mark, maybe you could take that and say, what do you see when people are making the decision to move to the Admiral versus staying at home, and how that just relates around community and friendship?
Sure. So when someone is staying at home and they want to see their friend, maybe they're able to see the friend a couple times a week, go for coffee. Here, you're able to see your friend every day as much as you want, as Angela says. You want to go listen to a concert? Well, we've got it here for you. You want to go to the pool? We've got it here for you. You need to go see the doctor? We've got it here for you. So I was not born in Chicago, but I was somewhat raised in Chicago, and I do not enjoy Chicago winters. So just that alone, it's all here. We have a huge sense of community. We have a lot of people every day, they're eating lunch together, eating dinner together. They're a new person comes in, they'll welcome them and, play a card game, have a snack, just take a walk around the community. And we see that a lot, that people really, buddy up. And there are some people that don't want to do that, and that's perfectly fine as well. Some people would rather be more to themselves, but you have all these services at your need, whatever you need, whenever you need. Something in the middle of the night happens. Our staff is here 24/7. And we have a nurse 24/7. So if someone's not feeling well in the middle of the night, there's someone that could be in your room, at your apartment in a very short notice. We're talking no minutes, whereas if you're home and something happens, well, maybe you call a family member to come over. Maybe you have to call 911 and go, to the hospital. Here, there's a lot of different things that we have, safety nets that are built in. And again, you're not seeing unfamiliar people either. You're not having someone come into your home to do something, either to help you to go to the hospital or help you this. These folks, you see them every day, and they're there, as needed. So I think that's huge for the community, having that sense of community, and then having those services at your fingertips.
Thank you, Mark. That leads into a question that we received. So this is a specific question. How is family involved with care, and how does the Admiral communicate with family? And what does that relationship look like?
So from the get-go, when I do the assessment, mostly families are present because it gives them that peace of mind to get to know us. And when you transition into the Admiral, we have something called the service plan. It's a very comprehensive assessment. It lasts about an hour, and families are always invited to chime in and join us. And the service plan compromise of everything that we do. We talked about all the physicians involved. We talked about all medication, diagnosis, the care that you want. And so your loved one is part of it. We get to know the resident and also their family or friends. They tell us, as we build the service plan, we build it together. So we get to know the residents, understand their needs, and how the family wants to participate in their care, with the resident being present and consenting to all of this. So it's like a team effort. We have a social worker, 24 hours, and she set up these meetings and facilitate them. And that service is very effective. The resident will get to meet the whole team. We have the director of activity in the meeting to explain all the different programs, and they will pick what is important to them, whether maybe they just like to go to the library or they want books and stuff like that. So during that initial transition, in my first assessment is getting to know the resident and preparing so that when they transition in, I know at least the baseline. And right after that, we do the service plan meeting to get to know the resident even more and fulfill all their expectation. And family members are well involved. After that, family members can call. I have a work phone that mostly is on 24/7, and they can call. I text with family. Mark and I were very responsible, and Dr. Mizuno, we text, we email. Like I said, it's like family. So I think I've never worked in a place that is more open in terms of communication, because we'll tell them, just call me and let me know what you need. So we pride ourselves in taking care of families and friends and partners, just like the residents, because it's all in one.
We sometimes hold resident panels that people are talking about care, and that's one of the number one things that people talk about is just really the caring and that's given to each resident, and even more so their, the resident with their entire family and how responsive. So thank you to the care team for all that you do. It's wonderful. We regularly hear that. And on the lighter side and specific side is somebody wants to know, what's the food like? How's the food? That's always a number one question we get. And I think we also have something to brag about of our new dining room. So I don't know who from the panel wants to take that question.
I can take that. So another unique thing that we have here at the Admiral is we have a full-time dietitian on staff. She is here. She's a registered and licensed dietitian, and she oversees the food and helps plan the nutritious menus. We have a variety of things that someone can get for every meal. Some people, and that's something that we're going to work with you and learn what your likes and dislikes. Some people don't like certain things, and they just want a cheeseburger every day for lunch. Well, that can happen. We're not, so it's a variety of menus that's constantly being overhauled and changed, just because we want to bring something different. We just want to have something different. There are tons of different varieties on the menu, but I think food wise, and that's always a tough subject, honestly. In my experience, that's something that's sometimes can be a sticking point. But we get very good reviews from our residents on our food. So it's something that again, it is what you want it to be. If you're a cheeseburger person, great. You can have your cheeseburger and fries every day for lunch. If you're whatever your thing is. If you don't like fish, well, we've got 5 other things for you. So
yes. And to echo Mark's comment earlier, assisted living has a private dining room, but they're also there's the bistro available and the waterfront dining for evening dining that's also available beyond. So there is another question that came through. It is, I think you answered a little bit, but the admissions, it says, what does the admissions process look like? So Angela, you did pretty much detail, the assessment and working one-on-one with the families. Is there any additional part that we maybe haven't covered on the admissions process?
So once they go through admission and we get the records that we need, I go in or they come in and we do the initial assessment and just to understand the person's need. Then Chris Zog, our admission specialist for ABOS, he will call the family and set up like time limit and what they want the apartment to look like. Chris is a perfectionist, so when he does a move, it will be like, I don't know how to say it, but the room will be exactly a room you will dream of living. So once I come back or they're here and we've completed all the processes with our admission team, Katie, your team, I hand over everything to Chris. I just follow up to know when they are coming. So I know my team is ready. And if maybe they need us to order medications or something prior to them coming in or whatever is needed, then I let Dr. Mizuno know. So those are like the areas that, I don't think Mark, is anything special that is needed?
no, I mean, we try and, walk everybody through the process, and that's something that Chris does. Chris is the person that, would do any paperwork and talks about, any finances or contracts and things like that. But he will walk someone through from the beginning to the end, from when they first, from when they look at the space and they choose that apartment, to do a space plan to help. If there's downsizing that's needed, we have folks that we work with, movers that we work with, all those different things. We have those services. And really get someone settled in and comfortable. And again, it's that familiar face you're seeing, or whether it's Karen, our social worker who's here, you will be seeing the same people, and you have someone to turn to if you need something, or if a family needs something. We're all here, and we're all readily available. So.
Right. And I would mention that both Angela and Mark are in currently model apartments for our assisted living. So when they talk about space planning and things like that, that's what, and they mentioned Chris, our admissions manager, those are the things that he helps with the space planning. But we have some beautiful apartments if you're interested in taking a tour. I think I've got a good wrap up question for each of you. And it was posed, what is a common misconception of assisted living and how are we different than that?
I think one of the misconceptions is the word you're coming into a nursing home. That's not true. I have worked in a standalone skilled care, and I can tell you that assisted living is completely different. The rules are different. The guidance and the policies are different. You're allowed to make your room. You're not, when you move into like a skill setting, there are furnitures in there that take away the opportunity for you to furnish as you feel like, even though you can still make some changes, but it's limited. In assisted living, it's an empty space and you make it what you want. That's the beginning of something really great, because you can choose your colors, you can choose a lot of things and how you want that room to represent you. And you can choose the time you want to wake up. I know you can do that in other settings, but it's like really home. You make it what you want. It's just home in a way that you still get cared for on the things that you really need to keep you safe and healthy and moving on. So it's very much a system of you choosing the lifestyle that you want.
Thank you, Angela. That's great. Michelle, do you have a point about that from your perspective?
Yes, I was going to say assisted living, you can actually live very independently in assisted living. So kind of going off of what Angela has already said, you can make your own choices, have your own lifestyle, have that privacy within your own apartment, but still have access to all the medical and healthcare provider needs within the floor and within the building itself, along with the activities and programs to engage and socialize in.
Yeah, I'm glad you pointed that out. And as I look at all of us is on our Zoom here, we're all in rooms, but if we all have beautiful views looking out at the city of Chicago. We have beautiful gardens here. So it's like not only living independently, but in one of the greatest cities in the nation, and right here on Lakeshore Drive, looking out at Lake Michigan. So it's also beautiful. Mark and Eric, or Dr. Mizuno, did you have anything to add to that point from your perspective, or is it covered?
I was just talking to somebody. She's coming into transition from IL to, she lives in the condos on the independent living side, but it's been agreed by everyone in her life. And she's coming to the conclusion that she does need some assistance. And it's such a gift that we can feel useful and have a purpose in life to do that. It's honor and a privilege. But I told her, I said, I can't speak for anyone, of course, but myself, but I'm single now. That's not an advertisement, but I literally live in 3 spaces in my house. I live in my bedroom, in my bathroom, and my kitchen. And I don't have a huge home. I have a 3-bedroom home, but I don't have a use for this other space that I have. It's just wasting natural gas and air conditioning. And so I literally think I live in about, and I told her, I said, come to think of it, I'm angry with you because this apartment we're in, it's actually bigger than my home. It's bigger than the space that I have. So I think if we're realistic about it, there's only like 3 functional places that we spend time in. And the rest there's huge common areas where you want to hang out together and get a large group together. Well, then, I don't really have a big enough house to do that anyways. I'm going to go out to a restaurant to do that with people. So I don't think that these apartments, and they vary in size and shape, but I think most of them are actually bigger than the size that I live in myself. But that's my personal perspective.
Thank you, Mark.
I just really want to echo what everybody said. That you do have that freedom, you do have that choice, you do have that option. But again, you've got that safety and security, and that familiarity with who you're seeing every day. So it's not something where it's really it can empower you. Honestly, we believe that if someone is getting the care that they need at that time and at right place or time, they're going to lead a more fulfilling life. Some people may say, well, at home, I don't want to go. If I go there, something's, bad's going to happen. It's the end of things for me. And it's really not true. It's really, we can provide the services that make your life better on a daily basis and, make it more enjoyable.
Yeah, we definitely hear that from residents, right? That they made new friends and that they are more active than they were when they were at home. And they are just trying new things and just more active than they were, and they're just living their best lives. So thank you, everybody. So thank you to our panelists, Mark, Dr. Mizuno, Angela, Michelle. Really can't thank you enough for all of your comments and your insights. For our attendees, you've had a chance to virtually meet our team, but I invite you, I have a couple of invitations to make to you. One is I invite you to meet any of these team members in person. Feel free to give us a call and schedule a time to, whether it's meet with Angela and have an opportunity to do, kind of a quick assessment to, is assisted living an appropriate level of care that we could be looking at for either ourselves or for a family member. Invite you to take a tour at any time and see the apartments and meet Mark, and he can introduce you to our care partners and the people that make the Admiral special. And if you have any information or questions that you'd like to, feel free to give us a call or check out us online. But thank you to our panelists. I think you guys covered a lot of very important points for people who are considering what's next, and have a great afternoon, and thank you so much.